You're 61, your 401k looks solid, and you're starting to think you can actually retire. Then you check what health insurance will cost before Medicare, and suddenly you're not so sure. Before you start comparing plans, start with one question. How many years do you need health insurance before Medicare starts? For most people, Medicare starts at 65. So if you retire at 60, that's about 5 years you need to cover yourself. Retire at 62, about 3 years. At 64, maybe 1. And that matters because covering 1 year is very different from covering 5. If you only have a short gap, keeping your doctors and keeping things simple may matter more. But if you have 4 or 5 years to cover, the cost can start affecting when you retire, where you take money from, and whether one spouse keeps working a little longer. Dave is 61 and Karen is 58, so Dave needs coverage for 4 years. Karen needs it for 7. Even after Dave reaches Medicare, Karen still has another 3 years to cover. In this video, I'll show you where to start and what to look at in your own situation so you can figure out which option makes the most sense for you. And there's one other possibility I want you to keep in mind. Sometimes the cheapest answer isn't changing your insurance, it's changing how you leave work. We'll get to that. If you're getting close to retirement and trying to work through decisions like this, subscribe. That's exactly what we focus on here. First, let's see whether you already have coverage available through someone else. If your husband or wife is still working and their job offers health insurance, price that first. For a lot of couples, it's the simplest option, and it may be cheaper than buying coverage on your own. Here's why. On the individual market, a 64-year-old can be charged about 3 times what a 21-year-old pays for the same plan. Employer coverage isn't priced that way. But don't assume your spouse's plan will be cheap. Some employers charge extra to cover a spouse. Others have different rules if that spouse could get insurance somewhere else. So ask HR what it would actually cost to add you. Don't just look at the employee-only premium. And pay attention to the deadline. When you lose coverage from your own job, you generally have 30 days to join your spouse's employer plan. The Marketplace usually gives you 60 days. Those are 2 different deadlines. You don't want to miss the shorter one because you assumed you had more time. There's one other thing to think about. If your insurance comes through your spouse's job, your coverage now depends on that job too. If your spouse gets laid off or retires, you may need another plan. For Dave and Karen, this option doesn't work because Karen's part-time job doesn't offer benefits, but their age difference creates another problem. Dave is 61, Karen is 58. When Dave turns 65, he can move to Medicare. Karen can't. She'll only be 62, so she'll still need another 3 years of health insurance on her own. That's why couples with an age gap need to look at both timelines. Getting the older spouse to Medicare doesn't solve the healthcare problem for the younger spouse. Next, check whether your employer offers retiree health coverage. Most employers don't. You're more likely to see it with government jobs, teaching, utilities, union jobs, the military, or some longtime corporate employees. If you do have it, find out exactly what you're being offered. Maybe the employer keeps you on a group plan and helps pay the premium until 65. Maybe they give you a certain amount of money toward a plan you choose yourself, or maybe they simply let you stay on the plan, but you pay the full cost. That last one is important. Just because HR calls it a retiree benefit doesn't automatically mean it's a good deal. So, get the details in writing. How much will the employer pay? Can your spouse stay on the plan too? What happens when you turn 65? And if you turn the coverage down now, can you come back later? Don't assume you can. Ask before you say no. You can also compare retiree coverage with the Marketplace. Simply being offered retiree coverage doesn't stop you from qualifying for Marketplace help. Enrolling in the coverage can, and if your employer gives you a retiree HRA, the rules can be different. You may need to opt out of that benefit before you can receive Marketplace savings. So, this is one of those things to confirm before you make the choice. If neither your spouse nor your former employer can cover you, then COBRA is usually the next thing you'll hear about. And that's when a lot of people see the full price of their old health plan for the first time. COBRA lets you stay on the health plan you already have. You can usually keep the same network, the same doctors, and the same prescription coverage. So, if you're already in the middle of treatment, you don't have to start over with a completely different plan. The problem is the price. While you're working, your employer may be paying a large part of the premium. You only see your share coming out of your paycheck. With COBRA, you pick up the employer's share too, plus a small administrative fee. In most cases, you can be charged up to 102% of the full cost of the plan. When that COBRA notice arrives, the number can be a shock, but it isn't necessarily wrong. You're seeing much more of what the plan costs. COBRA generally lasts up to 18 months after you leave your job. So when would paying that higher price make sense? If you're in the middle of treatment, switching plans may mean new approvals or finding a new doctor. Maybe you already have surgery scheduled. Maybe you finally found a specialist you trust. Or maybe you're taking a medication that took several tries to get right. In those situations, keeping the same coverage for a while can be worth paying more. Your deductible matters too. If you've already met your deductible or your out-of-pocket maximum for the year, switching to a new plan can mean starting over. Take Dave. He's leaving work in September and has already met his deductible. His knee surgery may happen in November. If he keeps COBRA through the end of the year, that surgery stays under the plan he's already been using. If he switches to a new plan in October, he may start with a new deductible. Depending on the plan, that could mean thousands more out of pocket. Then he can look at his options again for the new year. Your age matters too. If you're already 64, COBRA may cover most or all of the time you have left before Medicare. Before you make the decision, check your severance package. Some employers help pay the COBRA premium for a few months after you leave. If yours does, the cost may be very different from the full price shown on the paperwork. And if you have money in an HSA, there's another useful rule. You can generally use HSA money to pay COBRA premiums. You generally can't do that with ordinary marketplace premiums. That doesn't make COBRA cheap, but it may make the cost easier to handle. Now, there are 2 timing rules I really don't want you to miss. First, COBRA can be retroactive. If you elect it and make the required payment on time, the coverage generally goes back to the date your old employer coverage ended, so you do have some time to compare your options after leaving work, but don't treat that as an open-ended waiting period. You have 60 days to elect COBRA. After you elect it, you'll have 45 days to make the first payment. Those deadlines matter. And there's another rule that's easy to miss. Choosing to cancel COBRA early is not the same as COBRA reaching the end of its coverage period. If COBRA runs out, that gives you a special enrollment period to move to a marketplace plan, but if you cancel COBRA early simply because it's too expensive, that does not create the same enrollment opportunity. You may have to wait for the next open enrollment unless another qualifying event applies. If your former employer is helping pay your COBRA premium as part of a severance package, pay attention to when that help ends. When your share jumps to the full cost, you may get another chance to move to a marketplace plan. And remember, COBRA is temporary. 18 months won't get Dave from 61 all the way to Medicare at 65. If you're retiring several years before Medicare, COBRA may solve the first part of the problem, but you'll probably still need another source of coverage later. And for a lot of people, that's when the marketplace becomes important. If you need coverage for several years before Medicare, the marketplace is probably something you'll want to price. The important thing to understand is that what you pay can depend on your income for that year. For 2026, marketplace assistance generally applies to households between 100% and 400% of the federal poverty level. If your income goes above that upper limit, the assistance goes away. You can still buy the insurance. You just may have to pay the full premium yourself. And once you're retired, this is where something interesting happens. Where you get your spending money can change what you pay for health insurance. For example, money you take from a traditional IRA or 401k generally increases your income. A qualified Roth withdrawal usually doesn't. And if you sell investments from a brokerage account, it's generally the taxable gain that matters, not the entire amount you take out. Let's go back to Dave and Karen. Suppose they need $60,000 to live on. If most of that comes from their 401k, they're showing more income. But if some of it comes from cash they've already saved or qualified Roth withdrawals, their income may be lower. They're spending the same amount of money, but they could end up paying a different amount for health insurance. So if you're retiring before 65, don't plan your withdrawals and your health insurance separately. Look at them together. Now, if you're self-employed or doing consulting work, there's one extra thing to watch. Your marketplace assistance is based on what your expect income for the year, but your income may change. Maybe you get a bigger consulting project than expected. Maybe you take an extra IRA withdrawal. Maybe you sell an investment and realize a large gain. If that happens, update your marketplace income estimate. That's especially important in 2026, because if you received more advanced premium tax credit, you may have to repay the excess at tax time. That doesn't mean one good month automatically creates a tax bill. It simply means you want your income estimate to stay reasonably close to what you're earning. And finally, don't choose a marketplace plan based on the premium alone. Check your doctors and your prescriptions. Karen has been taking the same medication for years. If one plan covers it and another doesn't, that could matter a lot more than a slightly lower monthly premium. The same is true if there's a doctor or hospital system you really want to keep. And if you've priced the marketplace, COBRA, and everything available through work and none of it fits your budget, there's one more place to look: your retirement date itself. Maybe you've priced your spouse's plan, COBRA, and the marketplace, and none of the numbers feel comfortable. Before you give up on retiring, look at one more thing: when and how you leave your job. Sometimes, changing your retirement date by a few weeks or a few months can make the healthcare problem smaller. Maybe staying until the end of the year lets you keep your employer coverage longer, or maybe you've already met your deductible, and it makes sense to stay on that plan until January. Some employers also let you keep health benefits if you reduce your hours instead of leaving completely. So, instead of working 5 days a week until 65, maybe you work 2 or 3 days a week for another year and keep your coverage. It's worth asking HR, because these options aren't always known. And if you're married, you don't necessarily have to retire at the same time. Maybe one spouse works another year and keeps both of you on the employer plan. Let's go back to Dave and Karen. Dave is planning to retire at 61, so he has 4 years before Medicare. But suppose his employer lets him work part-time for 1 more year and keep his health insurance. Now he only has 3 years left to cover. Karen may be able to stay on his plan during that year too. They didn't find a cheaper insurance policy. They shortened the amount of time they needed one. That's the idea I wanted you to keep in mind from the beginning. And this is why you want to ask these questions before you leave your job. Once you've retired, some of these choices may no longer be available. So before you set your date, here's the order I'd work through it. First, how many years do you need to cover before Medicare? If it's about a year, keeping things simple may matter more than trying to save every possible dollar. If it's 2 or 3 years, timing starts to matter more, especially when you leave and when your deductible resets. If it's 4 or 5 years, then it's worth looking at the bigger picture. Where you take money from, and even when you leave work, can change what you pay. Then look at what coverage you already have available. Does your spouse have insurance through work? Price that first. And remember, you may only have 30 days after losing your own coverage to get on that plan. Does your employer offer retiree coverage? Find out exactly what they're offering before you turn it down. Are you in the middle of treatment? Have you already met your deductible? Are there doctors you really want to keep? Then COBRA may be worth looking at first, even if the premium is higher. And if you're going to use the marketplace, look at your income at the same time. Where you take your retirement money from can change the amount of help you qualify for. You don't have to price everything at once. Start with the option that fits your situation best, then compare from there. Before you retire, there are really 3 numbers I want you to know. How many years do you need health insurance before Medicare? How many years does your spouse need? And if you're using the marketplace, what will your income probably look like during those years? Then ask HR what happens to your coverage when you leave. Get it in writing. And don't plan your retirement withdrawals separately from your health insurance. If you're using the marketplace, one can affect the other. For Dave and Karen, that's what changed. Dave has 4 years to cover. Karen has 7. So Dave, reaching Medicare at 65 doesn't solve the whole problem. Karen still has another 3 years to go. Once you see it that way, the question gets a lot easier to work through. You're not trying to find the perfect health insurance plan. You're trying to find the best way to cover your years before Medicare. The details can vary by state, employer, and plan, and the rules can change. So always check the current information before you make the final choice. If this helped make the healthcare part of retirement a little easier to understand, please like the video and subscribe. I'm Allison. I read the fine print so you don't have to. I'll see you in the next video.